The UCSD student-run free clinic site was started by Dr. Ellen Beck and was first opened at the Pacific Beach United Methodist Church in January 1997. It is one of approximately 24 student-run clinic programs in the nation. Students plan, manage, and carry out clinic operations under the supervision of licensed healthcare professionals such as physicians, dentists, and pharmacists. The UCSD Student-Run Free Clinic Project seeks to provide high-quality and comprehensive care to uninsured and underserved patients throughout San Diego. The majority of these patients are the working poor. The UCSD Student-Run Free Clinic Project, in partnership with the community, provides accessible, quality health care for the underserved in a respectful environment in which students, healthcare professionals, patients, and community members learn from one another. The free clinic seeks to sustain health through free medical and preventative care, health education, and access to social services. The UCSD Student-Run Free Clinic Project is a nonprofit organization sponsored by the UCSD School of Medicine. The clinic funding comes from UCSD, grants, foundations, and donors. Currently, there are 3 student-run free clinic locations: Baker Elementary School, First Lutheran Church downtown, and Pacific Beach United Methodist Church in Pacific Beach. A team of volunteering pre-dental students, general dentists, and specialists provide comprehensive care to patients and improve their overall health and self-esteem. Patient restorative dental care, not solely emergency dental care, is made possible by the work of the UCSD Pre-Dental Society. UCSD students arrange for dentists to volunteer and treat patients on an appointment-only basis, except at the Pacific Beach site. The Pacific College of Oriental Medicine offers acupuncture services to interested patients in conjunction with the medical clinic. Social workers provide counseling for patients in addition to helping them access other available services, including housing, access to health care, and food, drug, and alcohol addiction treatment. In partnership with California Western School of Law and attorneys from the community, legal advice and referral services regarding issues such as immigration, family law, consumer law, and criminal law are provided. Limited notary services are also available. UCSD's Skaggs School of Pharmacy students volunteer at the UCSD Student-Run Free Clinic Project under the supervision of a licensed pharmacist. The clinic's pharmacy dispenses many types of medication free of charge to patients. Pharmacists and student pharmacists provide counseling and health education on topics including first aid, nutrition, hepatitis, diabetes management, drug and alcohol addiction, smoking cessation, blood pressure surveillance, eye disease, and preventative care.
So the first time I went into free clinic, I had a really great experience. I walked in not knowing really what to expect, but I learned a lot and it was extremely rigorous. And I remember the first time I went in, it was a lot to take in first. But I remember one of the patients I saw, they had like a lot of issues, just a lot of complications. And it was like really enlightening to see how, as a student pharmacist, how we could help them. And then the second time I came in, man, I saw the same patient again, and it was just a really good experience to be able to follow up on him, make sure he's taking his medications, adhering, and overall it's just a really great experience for everyone. And I know for a fact that everyone's going to have a really good time when they go.
The first experience is really good, and it really connects what the curriculum is teaching you with actual application. So I remember one of my most memorable experiences was when we were learning second quarter about diabetes and insulin shots. I seriously just learned how to give an insulin shot a week before I had free clinic, and then I go into free clinic, and that week, my first week, I counseled somebody on how to give an insulin shot.
I would say free clinic experience, it's your first experience with patient interaction in pharmacy school for a lot of us. And my first experience at free clinic, it was really eye-opening to see the first patient I saw. He came in he had diabetes, he had hypertension, he had high cholesterol, he had kidney disease, he had had a triple bypass. And so you have to be really open to being empathetic with your patients, and you go there and all you want to do is help them. And so it's really just putting your pharmacy knowledge to use in bettering patient care, and I think it's a really rewarding experience doing that.
Work with medical students and see what they do, see what they soap out and what we soap out, and how we collaborate as healthcare professionals to make a greater impact to our patients and to give a better diagnosis and a better treatment option for them, so that we can help them get better in a timely manner, instead of just having the doctor and the pharmacist all just separated.
They definitely specialize in a different breadth of knowledge than we do, and so you can see at Free Clinic how we kind of complement each other. Like, they'll know something and we'll know something that they don't know, and it's just, you can see like definitely a big emphasis on teamwork and how we can overall contribute to like a patient's health and how we can really help them.
I would definitely come back and volunteer at the Free Clinic. I have a lot of interaction with the patient, and it has a community component that's really critical for someone who's going into a clinical pharmacist position. You get to work with the dental students, with the medical school students, with the physical therapists. You get to see every component of someone's life and interaction with the medical health field. And so just being part of that facility, that environment, and providing free care to patients is a phenomenal experience, and I will definitely be going back to the downtown clinic, since that was the one I had the best experience with.
I would definitely come back to the Free Clinic. I plan on volunteering there in second and third year, just because it really puts your pharmacy knowledge to use that you learn in first year, second year, third year, and applying the knowledge is what's really going to help you become a better pharmacist, not just studying for tests. And so I would definitely recommend coming back, and I'm going to.
So my best advice for students who are coming either in the first year or even in their fourth year to rotate at the Free Clinic is to become well informed about the health issues that are affecting our country. There's a lot of health disparities that affect certain ethnic populations. For example, Hispanics have higher incidence, almost twice the rate of diabetes compared to Caucasians. African Americans have a higher rate of hypertension and so forth. The difference in health disparity obviously has to do for a lot of factors. One is the lack of healthcare, access to healthcare in the community, and that's where we play a major role. They also take on leadership roles in the Free Clinic, which adds on to their experience. And so being well informed on how politics, how healthcare is affecting obviously affects us, So that's one of my first things that I suggest, is reading up, being knowledgeable about these topics, because they're very important. Other things that I just kind of suggest, just come with an open mind. It's really important that you understand the plight of a lot of the individuals that we treat here at the Free Clinic. We treat a lot of patients who are homeless. 30% of our patients are homeless population. We have 85% of our patients have chronic diseases. That means they come with multiple disease states at once. So it's really important that you're really well versed in your pathophysiology, of disease states. Other things that I suggest is that you also are culturally aware of the different types of people that we treat here. 50% of our patients are Spanish-speaking. Majority of them are from Mexican descent. So it's really important to understand the cultural and language barriers that sometimes people have, and that as healthcare professionals or professional students we face when we're trying to approach patients and treat them properly. So that's another thing. And lastly, you just have to have a big heart to work here, because there's so much need at hand, but then you have to assess what's more important for a patient, and also kind of be able to identify key changes that you can do little by little. Remember, our patients have been in dire situation for a long time, and so it's not like you're going to change their world dramatically in one day. It takes time to be able to educate them on their disease state, and by them coming over and over again, and we're able to make changes little by little, and overall it's being a big change in their lives, and they can get better control. We have had patients who started off as homeless, they had psychiatric issues, we were able to treat them, they were able to find a job, they were able to get health care, and then they came back and thanked us for all the help that we gave them, that we provided for them, and they were able to completely change their life around. So it's amazing some of the people that we actually see here. Some of them are writers, poets, scientists. Some of them even have degrees, and they either suffer from psychological issues, and so they went all downhill. And so we were able to actually turn them around and make a difference in their lives. So I'm very proud of the type of work that we do here, and I hopefully want to inspire more students to come to the free clinic and do this type of work that's so much needed in the community.
You know, school's going to be challenging. Just stay with it, stay strong, and take as much opportunities to come to things like this, health events, and really refuel your passion again. And I think the clinics, health fairs are all great opportunities for you not only to do that, but also learn in the process and give back to the community.
We're actually a great model for a student-run free clinic. We put a lot of emphasis on student-run. On any given day, we have close to 70 or 80 students, medical, pharmacy students. We also have pre-pharmacy students, pre-medical students, and pre-dental students working here. Thanks to people coming together, the community coming together, and putting all their resources, including the institutions such as UCSD, we're able to do this. Without them, we couldn't run.